Harmony. I'm a PN student at Williston State College, and today I'm going to show you how to administer intradermal and intramuscular medications. I am currently at the med station, and I am going to verify my MAR and compare it to the provider order. So I have Shirley Coast, date of birth 4/3/1987. She's a 33-year-old female under the care of Dr. Iston. She's admitted for pneumonia, and we are administering her 10 o'clock medications. Looks like we have a PPD skin test ordered, which would be with tuberculin, purified protein derivative, diluted 0.1 milliliters intradermal once on her right inner arm is where he'd like it, at 10 a.m. Ceftriaxone, 250 milligrams IM once a day at 10 a.m. And then we've got Phenergan, 25 milligrams IM twice a day as needed for nausea, and we're going to be using the Z-track method. So the MAR and the provider order matches. I see on her MAR that she's allergic to penicillin and furosemide, and that there's no contraindications to give this medication. So now I'm going to verify. The box says Shirley Coast, date of birth 4/3/1987, 33-year-old female under Dr. Iston's care. Perfect. So then I'm going to wash my hands and put on gloves. Okay, so we're going to first pull out the tuberculin. And tuberculin is a multi-dose vial, so it's already been labeled and initialed with the date and initials of the previous person. Tuberculin, purified protein derivative, 0.1 mLs, and it's going to be intradermal once on her right arm, at 10 o'clock, and it doesn't expire until 10/2064. Then we've got our Phenergan, 25 milligrams IM twice a day as needed for nausea. We're going to use the Z-track method. We've got 25 milligrams for deep IM, and it doesn't expire until 3/2033. Then we've got Ceftriaxone, 250 milligrams IM, and we're doing this once a day. This is a 500 milligram per ml after we constituted with 10 milliliters of sterile water, and it doesn't expire until 10/23. So our sterile water, it's good until 7/2024. Now we are going to prep the medications to be drawn up. Okay, so first we're going to prep our tuberculin. I'm going to clean it with alcohol, starting at the inside of it and going in circular motions to the outside. Allow it to dry, and while it's drying, I'm going to prep my needle to draw it up. So we're going to need 0.01 milliliters, so I'm going to draw up 0.01 milliliters of air and inject that into the vial, and then withdraw a little bit more than I need so that I can get the air bubbles out. And we are going to remove the air. So you see 0.1 mLs. I'm going to use the swoop method to recap the needle. And then I'm going to label it. So I'm going to fill out tuberculin. We've got tuberculin, purified protein derivative, 0.1 mLs. Doesn't expire until 2064. 0.1 mLs, my initials, today's date, and the time will be 10 o'clock. I'm going to label that. And I can put the multi-dose vial back in the med bin. Then we've got our Phenergan, 25 milligrams per ml, twice a day is needed for nausea. It says for deep IM use, doesn't expire until 2033. And I'm going to grab a filter needle and just remove syringe. This in the sharp. Okay, then I'm going to clean the ampule around the neck with alcohol. While that's drying, I'm going to grab my gauze. Then I'm going to break the ampule away from me and place it in the sharps bin. We don't have to draw up anything because we only need 1 full ampule for this dose. Okay, so it should be 1 ml, which that is 1 ml. I'm going to draw back. Use the swooping method to recap my needle. Place that into the sharps container. And then put my administration needle on. And place this in the sharps container as well. And then remove all the excess air out of here. You can see we've got 1 ml of phenegrin, so I'm going to label that. Phenegrin, 25 milligrams per 1 ml, initials, date, and time. And then I'm going to label my syringe. And then we have to reconstitute the ceftriaxone, 250 milligrams IM, once a day. And we have ceftriaxone, it's good until 2023. We need 10 ml of sterile water. And I'm going to clean both tops, starting in circular motion, working my way out. Use the opposite side to clean this one. I would use a different one to clean the garbage. Okay, while that's drying, I'm going to prep my syringe to draw this up. Grab another filter needle and a 10 milliliter syringe. And then we're going to draw up 10 ml of air. And then push that air into the sterile water vial. Make sure that the needle is below the water level so you don't get any air bubbles. Okay. So we've got 10 ml of sterile water. We're going to inject that slowly into our ceftriaxone powder. Using the swooping method, I'm going to recap the filter needle and mix this between my hands, rolling it, making sure that there's no powder left over. It should be a clear solution with no clumps in it when it's all mixed. Again, it doesn't expire until 2023, and this is ceftriaxone, 250 milligrams, and it's a 500 milligrams per ml, so I only am going to need to draw up 0.5 ml after doing my dimensional analysis. Now I'm going to place my needle onto my drawing syringe or my administration syringe, pull up 0 or half an ml, inject that air into the solution and draw up 0.5 ml. I drew a little bit more than I needed so that I can get the air bubble out. And we will remove excess air. And then I'm going to draw back, recap the needle using the swooping method, place this needle into the sharps container, and place the administration needle on. And then remove the excess air. And we've got 0.5 ml. Now I'm going to label my ceftriaxone. This will go into the sharps container. So we've got ceftriaxone, 250 milligrams per 0.5 mLs. My initials, date, and time for 10 o'clock. Okay, so my medications are now prepped and ready to go into the patient's room. And we will do one more check while I'm out here. Tuberculin, 0.1 milliliters. And this is an intradermal injection. Phenergan, 25 milligrams per 1 ml, which we've got. And it's going to be the Z-Track method at 10 a.m. Ceftriaxone, 250 milligrams IM, and that's for her pneumonia, and we've got 0.5 mLs. Okay, so I'm going to take my medications that I've prepped and go into the patient's room. I will knock. As I enter, I'm going to introduce myself. Hello, Shirley. My name is Harmony. I'm a nursing student, and I'm going to be giving you your medications. I am going to pull the curtain for privacy and wash my hands. I'm just going to raise the bed up to a good working height. How are you today, Shirley? Good. Can you spell your name and can you verify your name and date of birth for me? Shirley Coast, date of birth 4/3/87. Okay. And do you mind if I sit you up? Okay. So again, we've got Shirley Coast, 4/3/87, 4/3/87. Perfect. And I see on her wrist that she's allergic to penicillin and furosemide. Is that okay there? Okay. So now I'm just going to prep your medications and do one more check, okay? So I'm going to make sure we've got tuberculin, 0.1 milliliters, and this is going to be the intradermal one. The tuberculin's to make sure that you don't have tuberculosis, okay? And that one we're going to check up on you in 48 to 72 hours. Phenergan, 25 milligrams IM, and this is as needed for nausea. We've got that. Ceftriaxone, 250 milligrams IM, once a day. Okay, so everything confirms. We've got this all prepped for Shirley Coast. Nothing is expired. I'm going to wash my hands and put gloves on to administer. The ceftriaxone we would administer intramuscularly for her infection. She's here for pneumonia. And then we are going to administer Phenergan using the Z-Track method. So I'm going to palpate the acromion process. Here it is. And then I'm going to go 3 fingers below that. All right, Shirley, this is going to be a quick poke. Might be a little painful. We're going to clean from inside to outside in a circular motion. Let that dry. As it's drying, I'm going to grab my Phenergan, 25 milligrams. I am as needed for nausea. And then I'm going to get my gauze. Okay, so I'm going to uncap the needle, make sure the bevel's up. We palpated. We're going to Z-Track method, so pull the skin to the side. 1, 2, 3. And then we're going to administer at 10 to 15 seconds per ml. This was 1 ml. Okay. And as soon as we remove that, we are going to cap the needle and put pressure. That would go into the sharp spin right away. Doing okay? Perfect. So I'm going to hold that for about 10 to 15 seconds. She's not bleeding at all. Okay, now we're going to do your tuberculin injection. It's going to go on your right arm, okay? So I'm just going to move the skin down here. We're going to do it on your right lower forearm. Okay, so the tuberculin, we're just going to make sure that you don't have tuberculosis. And I'm just going to make sure we've got our tuberculin, 0.1 mLs. Again, 0.1 mLs. I'm going to prep the site, cleaning in a circular motion from the inside to the outside. Okay, then I'm going to get my gauze. All right. So we're going to make sure the bevel is up, pull the skin nice and taut, go at a 15-degree angle, make sure you can still see the bevel underneath the skin, insert, make sure you get a bleb, remove the needle. As soon as you remove it, cap it, dab the excess fluid that may be coming out. Discard this into the sharps container, and I'm going to circle the bleb. I'm going to initial, date, and time it. Okay, Shirley, so I've initial dated and timed this so that we can come back in 48 to 72 hours to make sure that there's no reaction, or if there is a reaction, that we can provide you with the proper care. So I am going to come check on you in about 30 to 45 minutes to see if that Phenagrin's started to help you with your nausea. Is there anything else I can get for you? Okay, I'm going to lower you back down. And here's your call light. Do you want to be upright or do you want to lay down? You want to stay upright? Okay, so here's your call light. I'm going to document everything before I leave. So we're just going to put in that I gave you tuberculin in your right arm, Phenagrin in your right arm. We administered the ceftriaxone, and she tolerated it well. As I'm leaving the patient room, I'm going to be washing my hands.